I am going to invite Dr. Peter Selby, who is a clinician scientist with the Addictions Division of the Center for Addiction and Mental Health. Dr. Selby, we welcome your presentation.
Start by declaring that CAMH is a 500-bed hospital which conducts research, education, and policy and implementation, and our focus is on patients suffering from mental illness and addictions. We have a strong focus on tobacco addiction, right from scientific studies from molecular levels to brain imaging levels to genetics, as well as clinical research and research that has to do with policy and public policy, and we sponsor the Ontario Tobacco Research Unit and one of its founding partners. With respect to our philosophy is we are strongly focused on helping people who suffer from disparity and disadvantage in society, and as we know, the tobacco epidemic is focused on this, is rampant now on this population of Canadians, and roughly is killing 37,000 Canadians annually, which is roughly about 10 times, to put into perspective, about 10 times, at least 10 times the amount of people getting killed every year from opioid overdose, and we know what that epidemic is doing to society. With the other caveat is that we have done research and have worked with companies, but not for companies, to develop smoking cessation treatments, and we run a large smoking cessation treatment clinic in Toronto that treats roughly 1,000 patients a year, but through our programs in the province, we amp that up to about 25,000 smokers who we help with standard treatments. Having said that, I think it's a sobering fact from our research is that despite the most motivated patient or the most motivated person who's coming to make an attempt to quit, most of them will go back to smoking within 3 to 6 months. And that is the reason why we are very interested in looking at ways in which people can reduce their harm from tobacco use, and especially because most of people, as you know, die from the smoke, not the nicotine. So that is our focus. And when we look at this bill, we are very pleased to see the way it is separating out a therapeutic option, which clearly should go down a therapeutic arm and division and development as a medical product for cessation. However, we see the benefit of the amendment that will allow easier access, especially to patients with mental illness and other addictions, to a product that, based on our estimate, even though we don't have 100% confirming evidence, but based on the contents of what vaping devices bring compared to the types of combustible products that our smokers have and the health products that and the health effects that they experience, we are very pleased to see that the possibility of a harm reduction paradigm. And this is consistent with our approach to harm reduction in Canada, whether it's supervised injection facilities, whether it is prescription heroin, whether it's the legalization of cannabis. We see this being consistent with paying attention to the number one addiction in Canada and creating a harm reduction paradigm for smokers who are unable or unwilling to quit at the moment. So from the product, we hope that this bill could be tightened up to make sure that there's a clear distinction between vaping products and tobacco products. So, for example, the heat not burn products should definitely not be considered vaping products under this legislation and should continue to be viewed as tobacco products until we can show with clear certainty that it does not have any of the combustible elements that are being put out by combustible cigarettes. We also want to make sure that the framework includes that even if people are selling vaping devices, that they are manufactured under good manufacturing practices, that there are standards in place that right from the metal, right from the filaments, right from the cartridges, that they're all manufactured for and generally safe for human consumption. In addition, we should make sure that the batteries have meet some sort of standard, and lastly, so that they do not overheat and they do not explode. And lastly, the e-juice or the liquids are manufactured with concentrations that do not serve a danger to those who are those who are not tolerant to nicotine, especially young children, and also that we continue to make sure that that manufacture happens in Canada, because when we talk to people who use vaping devices, most of them are buying the product in Canada, and it is an opportunity in Canada for us to make sure that people continue to use a Canadian product. In terms of the practices, clearly the policies need to further promote the practices such that not allowing vaping where tobacco is not allowed, and keeping it consistent so that we do not create confusion in the market and in people's mind. And lastly, what we want to make sure is that the policies that are in place do not favor tobacco products. So, for example, in terms of the amendments to the advertising, we do want to make sure that adult smokers who are addicted and have an inability to quit, or have tried or for whatever reason do not want to try the regular medications to quit, we should make sure that they can make an informed decision. This means that they should be able to have access to the current latest evidence at the sites where they do get that information, for example, in a vape store, for example, and we do need to make sure that they can make an informed choice if they're going to make that choice to switch from combustible tobacco products to vaping devices. We know that the Public Health England report has been controversial, but really what we're quibbling is over whether it's 95% safer versus 30% safer. And I think in this day and age where we have that kind of mortality and devastation of families and premature loss of life due to tobacco in the country, I think we need to take a pragmatic approach like this bill is trying to do, and make sure that the adult public can make an informed choice to switch over. In addition, we do want to make the playing field unlevel in the sense that it becomes easier for people to switch to non-combustible products and not have matters in legislation that somehow equate vaping devices to those of combustible cigarettes. So in terms of advertising and allowing people to make that choice so that they can be aware of it, and reaching adults in ways that they want to be reached, and using current market forces as a way to help them do that is critical. At the same time, we do need to protect young people from using these products in the sense of to initiate the use of tobacco and preventing that issue. But I can tell you that our subset of patient populations where their mental illness often starts in a young age, almost all of them are heavy smokers before their 18th birthday. And what we don't want to do is have them start using those products, cigarettes, and have no option of using safer products. Potentially safer products that might be on the market, and somehow not allow healthcare professionals to have those conversations with them, to be able for them to not go down the path of combustible cigarettes. The other concern that we have, which is relevant, is the issue of co-use of tetrahydrocannabinol, or THC, or the active ingredient in marijuana, in vaping devices, and we want to see that there's a deterrent to that co-use. Although there does need to be a development of non-combustible ways of consuming marijuana that can be consistent with other legislation, with the legalization of marijuana happening in Canada. What we don't want is people being able to smoke a vegetable product, which is marijuana's joints, and not getting them off the combustible form of ingestion. So when we look at this, we look at it in its entirety. Is this bill, in terms of how it affects most vulnerable Canadians, 1 in 10 Canadians who will have a mental illness and who have smoking rates that are 4 to 5 times that of the general population. So in summary, we support what this bill is trying to do. We believe that some of the tweaks that can be made will allow adults to, especially those who are unable to quit, to be able to switch over, knowing full well that the product is generally been regulated. We also know that it could help young adults underage individuals not get access or believe that this is a product to initiate. So the ban on flavors, for example, is a good idea, and we support it and we support that. In terms of information to the smokers, we agree that this is not a lifestyle product and should continue to be provide factual information to the smokers so they can make an informed decision to switch.